Hello, I'm Dr. Lee. Welcome to Practical Pain Management. In this video, I'll introduce a manual mobilization technique of the glenohumeral joint under brachial plexus block for the release of a fibrous adhesive capsule. I'd appreciate it if you could turn on the English caption for better communication. Most of the frozen shoulder patients visit a hospital for their pain and limited motion. Inflammation and fibrosis are basic pathology. Pain comes from inflammation, fibrosis, and adhesion. It can be treated with NSAID and steroids. Limited range of motion comes from fibrosis and adhesion. It cannot be treated with NSAID or steroid. It should be treated with self-home exercise and mobilization. I undergo manual mobilization with interscalene brachial plexus block in severe LOM. Let's go to the clinical practice. For successful manual mobilization, complete paralysis of the upper extremity, including sensory loss of glenohumeral joint and muscle, is essential. It is easy to manually mobilize the glenohumeral joint if block was not complete. If you do not hold the humerus head in position, you may not achieve the inferior capsule stretch. It may worsen subacromial impingement or damage the tissue. Having and pushing down the humerus head is the key to successful mobilization. First, let the patient's side lying. While holding and pushing down the humerus head with one hand, I mobilize the arm with the other hand. Next, let the patient supine position. I will elevate the arm with one hand while the other hand push down and compressing the humerus head. At this time, I am using my thigh to push the arm upward. I am sure you can notice how much she increases her range of motion. Finally, I will increase the range of internal rotation and extension. With repeated mobilization, I have achieved the increased range of motion. Please compare the range of motion before mobilization. Please prepare the arm sling. Arm sling will help my patients safe back home. Thank you for watching. If you like this video, please subscribe to it.